Hey everyone, my name is Brianna Wilson. I am a certified dementia practitioner and the founder of Bambu Care. So today is our Q&A series number 6, where I answer 3 questions each week from our viewers, our listeners, and our fans. So if you have a question that you would like answered, you can submit your question at letsbamboo.link/QA, and I'll also provide that link in the description box or in the comment section depending on where you're listening to this at, okay? So let's go ahead and get started with our 3 questions. Thank you to those of you who submitted your questions to make this week's episode possible. So without further ado, question number 1 is, how important is a definitive diagnosis for dementia? Now, my instinctive answer to this question is, it depends, because it does, which I know everyone hates that answer, but it's true because it does depend. So let's take it back to the beginning. So let's say that your partner is displaying symptoms of dementia, but they haven't been formally diagnosed. So it's just something that you're noticing and you're just kind of making an assumption that, maybe mom, maybe dad, maybe grandpa, whoever has dementia. It's important that you do get them to the doctor for further assessment, because you have to remember with dementia as a broad term is a collection of symptoms. Dementia is a syndrome, okay? And these are impairments in memory, thinking, and behaviors to the extent that it impacts daily functioning, okay? But there's something that's causing the dementia. And even though typically when we talk about dementia, we're talking about progressive dementias, there are also what we refer to as reversible dementias or pseudodementias, okay? So some of those pseudodementias or reversible dementias could be like depression. It could be due to different medication side effects or drug interactions. It could be due to alcohol or drug abuse. It could be to vitamin deficiencies, especially when we think about B12 or folate. It could be due to thyroid issues or infections, even exposure to like environmental toxins, and of course things like brain tumors, okay? So your first question, if you feel like your partner is displaying dementia-like symptoms, should be, what is causing it, okay? And the best way to figure that out is to get them to the doctor. Now let's say that you're past all that. You've taken them to the doctor, and the doctor has given you a vague diagnosis of dementia unspecified. At that point, how important is it for you to get a definitive diagnosis? Again, it depends. So of course we know that the more you know about the specific type of dementia your partner has, the better able you are going to be able to prepare and care for your partner, because each dementia kind of comes with different symptoms, especially in the early and middle stages. Now, as dementia progresses, all the dementias kind of start looking the same, but especially in the early and middle stages, it is kind of important to know the type of dementia your partner has, okay? And the biggest reason, in my opinion, outside of just kind of being aware of what to expect, is when it comes to medications, if that's the route that your family chooses to take, because a lot of people want to give their partners what they feel like is going to be helpful. And in this day and age, we are very heavy on medications, probably a little bit too much. But it's important to know because in general, people who have dementia tend to be more sensitive to medications, but there are certain types of dementia that are even more sensitive to certain type of medications. And so that's important to know, because if the doctor prescribes the wrong medication, it could end really badly, and in some cases even result in death, unfortunately. So 2 of the dementias that come to mind when it comes to being aware of what medications to avoid is frontotemporal dementia and Lewy body dementia. So with frontotemporal dementia, Typical medications like Aricept, Exelon, galantamine, which are cholinesterase inhibitors. These are medications that are typically prescribed for people with dementia because they're supposed to help with the impairments in memory and thinking, okay? Those medications are not typically recommended for someone with frontotemporal dementia because they can actually cause increased agitation in some cases, okay? When we think about Lewy body dementia, which can look very similar to Parkinson's disease, it's important that we kind of get that differentiated because some Parkinson's disease medications can actually end up increasing confusion, increasing delusions or hallucinations, okay? Another medication you have to be really careful with when it comes to Lewy body dementia is antipsychotic medications like Haldol, because it can actually end up causing some pretty severe reactions such as Parkinsonian symptoms, immobility, confusion, and this could actually end up being irreversible, and in some cases it can even result in death, so you just have to be super careful. People with Lewy body dementia can also have bad reactions to anti-anxiety drugs like Ativan or Valium, or anticholinergic drugs that people love to give like Benadryl. So if you don't know this, or if the doctor also isn't aware, they could end up being prescribed something that could make their condition worse. That's the point. So if you're not sure what type of dementia your partner has, and if maybe the primary care physician is the one who gave the diagnosis, I would strongly suggest that you take your partner to a neurologist or a neuropsychologist that actually specializes in dementia so that you can get a formal diagnosis. However, if you find yourself having to jump through 3 million hoops, or your partner is just not tolerating all this testing, then having a definitive diagnosis is not the end of the world, okay? Will it help you in caring for your partner? Yes. Could it help you avoid some pretty serious drug side effects? Yes, but if you focus on kind of taking your partner as they come and researching the symptoms as they come, you can do just as good of a job as anybody else. And then as far as the medications, it's really the doctor's responsibility to kind of be on top of that stuff. But you also want to make sure that you're not just reaching to medications for everything, and that you're really focusing on what might be causing the behavior, because a medication might not even be needed. Most behaviors are caused by an unmet need. So if you can identify what that unmet need might be, a medication might not even be necessary, okay? So hopefully that answers your question. I know I kind of answered it in a roundabout way, but it really does depend, okay? And it depends primarily on your goals of care and how well your partner is kind of tolerating that whole process of getting an official definitive diagnosis, okay? The second question is, do all dementia patients get bedridden before they die? So unfortunately, if the dementia is able to progress through its full course, then yes, the person will ultimately end up being bedridden. And it doesn't matter what type of dementia that they have as the dementia progresses. When we get to the late stages, all the dementias kind of start looking the same as far as the brain's ability to communicate with the body, okay? And so some of the things that you're going to start noticing is that the reflexes might start to become abnormal, the muscles begin to grow rigid, the person might start having difficulty holding their head up or being able to sit without support. They'll gradually lose the ability to walk. They'll have issues swallowing, and the person may lose the ability to speak altogether, or even lose the ability to smile, okay? So with that being said, not all people are going to pass away at stage 7, okay? Because people can pass away from a lot of other underlying health issues and conditions. And you have to remember, because dementia is impacting the brain, it's also impacting other body systems. And so it's very common for someone like with vascular dementia to pass away from something like a stroke or a heart attack. Or if your person has things like diabetes, they might have diabetic complications that send them down a different pathway. Okay, so not everyone is going to get to stage 7 and then pass away, because they could end up passing away from something else. And so they might not actually end up being bedridden before they die until like their very last days. Does that make sense? And then we have question number 3. How do you answer the question, so how is your dad doing? Now, I actually find this question pretty interesting, and it's actually a question that comes up pretty often. People have a hard time answering this question. So I'm going to answer this question in a more personal kind of way. So when we think about getting asked this question, so how is your dad doing? There's different people that can ask this question, right? You have people who are genuinely concerned and wanting to know how dad is doing. You have other people who are asking because they're just doing it out of courtesy. And then you have others who are just doing it to be nosy, right? So that happens. So I feel like the answer to this question is going to be depending on who is asking the question, because it honestly isn't everyone's business to know that your dad has dementia or how he's doing. So if you feel like the person doesn't really care and that they're just asking for courtesy's sake, you can really just give them a basic answer of, oh, he's doing good. Oh, we're just taking it day by day, and just giving a kind of vague answer like that. But I know people struggle with this because they feel like, well, with dementia, how good can you really be doing because the brain is dying? But I want you to kind of look at it as more as, how is dad doing emotionally or like well-being wise? So for example, some people are actually genuinely happy. So you can say, oh, dad is doing good. He's happy. We took him someplace and he enjoyed it. Now, this would be an answer for people who you feel like actually care. Honestly, if a person isn't really asking you because they care, I wouldn't give them this long, drawn out explanation. I would just keep it simple, But if the person actually genuinely cares, you can say that, dad's doing really good. He's been in a good mood lately. We took him here. He seemed to really enjoy it. But other people, they have anxiety. So, overall, he's doing pretty good, but he has been a little bit anxious lately. So we've just been trying to manage that, or, whatever's going on. But again, don't feel like you have to give people that level of detail if they don't really care, because it's not necessary, honestly. So I guess to answer your question, how do you answer the question, so how is your dad doing? For those that actually care, try to be honest and focus more on dad's emotions and overall well-being. Try not to focus so much on the diagnosis, because I know sometimes we can get stuck there. So focus on the positives, okay, but try to be honest about it. And if someone is asking and they're genuinely interested, don't be afraid to see if they can help you in some way, especially if it's like a family friend or another family member or something like that, because it's really hard to go through this journey alone. So if there is an opportunity to enlist someone to help, even if it's just to help you watch dad for an hour so you can run an errand, or even if it's just for them to call and check on you, because I know a lot of care partners get really frustrated because people do ask, how is your dad doing? But they never ask, well, how are you doing? Because I don't think a lot of people understand how tough of a job it is to be a caregiver, to be a care partner. So, asking them to check on you or saying, hey, if I need you, is it okay if I call just so I have someone to talk to, something like that. But again, to answer the question, so how is your dad doing? For people who actually care, just try to be honest and try to focus on their emotional state and their overall well-being, okay? So that wraps up Q&A Series 6. If you guys have any questions that you would like to submit for another episode, don't forget to submit your question at letsbamboo.link/QA. And until next time, bye guys.